Let me tell you about PRP and stem cell therapy for chronic pain. If you're suffering from chronic pain, this is a new modality of treatment that I think is very useful. PRP stands for platelet-rich plasma. Platelets are normally found in the blood. They normally constitute about 10% of the blood. Blood contains red blood cells, white blood cells, and platelets. Platelets are normally function to initiate a healing mechanism when there is an injury. If you cut yourself, the platelets go to the area of injury and initiate a repair mechanism. Platelets contain growth factors. Growth factors are released when there is an injury in the soft tissue. We concentrate the fraction containing the platelets and change it from 10%, which is the normal in the blood, to over 90%. This is a 4 to 5-fold increase in the concentration of the growth factors. We then target the growth factors to the site of injury. Therefore, any location of pain that can be reached with an injection is potentially treatable with this modality of care. Growth factors are found in platelets normally, but when they're concentrated to a greater extent and targeted to the location of injury, this is where the beneficial effects of PRP start to take place. We are initiating a series of healing processes to aid the body in healing itself. Unlike other modalities, which include cortisone injections, which decrease inflammation but do not initiate healing process, or surgery, where usually it means if there's a tear, cutting the tear. If you've had repeated cortisone injections and have had benefit but has not been lasting, you may be a candidate for this treatment. As you know, cortisone does not heal. It is a mechanism where you decrease inflammation. Repeated cortisone has potential problems. It can cause suppression of the body's own steroid production. It can weaken tendons, ligaments. In fact, the major tendon in the foot, Achilles tendon, it is not recommended that you have a cortisone injection. Unlike PRP, which can actually cause repair and healing of the tendon. It is also an alternative to surgery. It is far less invasive. There is decreased potential for complications. PRP is completely natural. It is your own body's blood. We are not taking any foreign object and injecting into the body, so the risk of allergic reactions, rejection is not there. PRP is useful in treating many conditions. If you have injuries to any joint in the body that is reachable with an injection, is treatable. Injuries to the shoulder, elbow, wrist, knees, hips, ankle are all potential treatments. Common types of injuries you have heard of is shoulder rotator cuff tears, injuries in the elbow such as golfer's elbows or tennis elbow is treatable. Labral tears in the hips, knees is treatable. Achilles tendonitis in the foot is treatable. So many areas are potentially beneficial and alternatives to surgery. You may be wondering, why is PRP so effective in treating pain conditions? As I've mentioned before, the body normally heals itself, but this may sometimes be short-circuited for various reasons. A lot of times tendons, ligaments do not have a very good blood supply. Therefore, the growth factors and stem cells are not able to reach the site of injury, or the body may not be able to recognize that the area is injured. When you direct the growth factors by the platelets, you are targeting that location and aiding the body's repair mechanism.